Hello everyone, it's Girish Srinivasan here, your physiotherapist from Edmonton at In Step Physiotherapy. Today we're going to talk about 5 ways how your acute pain turns into a chronic pain which is going to trouble you for months or years. Number 1 reason, inaccurate explanation of pain. You have a lot of pain. Let's take back pain as an example. You have so severe acute back pain, you can't even walk. You go to the doctor's office like this with a lot of pain and nobody explains to you why that pain is there and what pain is. Pain is not just the tissue injury. Pain is more than that, and it depends on your context where you're in, your past experience with pain, and what happened, when it happened, who's with you, and about stress in your life, about work, whether you're sleeping well or not, you're eating well or not, you're moving well or not. There are so many things involved in components of pain creation, not just the tissue injury. That inaccurate experience or inaccurate explanation of pain is the number 1 reason for your acute back pain for 1 or 2 days can turn into a couple of years of chronic back pain. Number 2 reason, the spread of pain myths. There are a lot of people around there, including medical community and paramedical community and your friends and families. They will have a lot of pain myths in their brain which will transmit, or they'll let you know about this thing. Oh, if you got back pain, you can never get cured. You will be having that all the time. Oh, any pain in the leg, you got sciatica, right? They don't know that radiating pain in the leg can be so many other things other than sciatica. Not all leg pains have sciatica, right? Oh, you got rotator cuff pain, you should have corticosteroid injection. That's the only relief you can have, right? If you got a headache or migraine, take Tylenol. Because they don't know this can come from the neck. If a motor vehicle accident, you wait for the insurance company to send you the forms to go for the treatment. No. All physio clinics have forms. You can come and take care of the pain right away, right? There are so many myths around in this community about pain. But if you want to get the right information, talk to your registered physiotherapist. Call me. Number 3 reason for your acute pain can turn into a chronic pain is the overuse of imaging. Right? Without no reason or rhymes, everybody sent for x-rays and ultrasounds and MRIs. For what? First have a good clinical examination, see if there is a need for imaging, then go for it. If you have an ankle sprain and then we know there's a sprain, clinically you can examine it. You don't need x-ray or ultrasound unless you suspect a fracture. If you want to rule out a fracture, yes, you need imaging. So, and also a lot of things you don't see in the image, which can give you pain. Not everything which causes you pain will be shown in the image. Sometimes there will be a biomechanical dysfunction. No image can pick that up. Only a clinical examination will pick it up. Even if the ultrasound shows bursitis in your trochanter, we all know it's bursitis. But will your image tell you what causes that bursitis? No. A good clinical examination by physiotherapist can find out why that bursa is being irritated. Who's not working around here? Is your glutes not firing very well? If your lower back is not moving very well, or your thoracic spine is not moving very well, or your hip stability is not great, which can cause more stress in the bursa, which can irritate it. So all those things can come only with a good clinical examination, not just by imaging. So there is a lot of overuse of imaging, and you take the x-ray or something and see, oh my God, you got bone on bone here, and that's a pain. No, bone on bone, you can still do squats without pain. So don't get overwhelmed by what you see in imaging. Talk to your physiotherapist. Reason number 4, right here. Poor treatment planning by your medical team, right? When you are going with acute pain to any kind of medical professional, if you're getting bombarded with muscle relaxants and anti-inflammatories, there's a problem, because inflammation is the first stage of healing, right? There has to be some things, inflammatory processes to go to the next stage of healing. So you cannot bombard yourself with anti-inflammatories and muscle relaxants, okay? And go see a physiotherapist right away. And physiotherapist also, when you're treating, we have to educate you about your condition, about the pain, and also we have to practice some lifestyle medicine, and we have to be a health coach for you. We are not fixers or healers. We got to take everything into account. If you're coming with a lot of pain, I'm going to talk to you about your sleep, about your diet, about your stress, about your social life. It's not just about the pain and the tissues. We are moving away from the tissue-driven practice to the patient-driven practice and lifestyle medicine, right? It's not just all about your tendons, muscles, and joints anymore. It's much more than that. And that's what a good clinician with a good pain neuroscience education will provide you, right? So you have to educate you properly. Education and empowerment is the first thing. That's why I have this show, physioshow.ca. You can check it out. A lot of conditions has been videotaped there and archived there. You can educate yourself and have a very good knowledge about what is the right thing for you. Proper treatment planning, some hands-on if needed, some pain modalities if you need it, pain relieving modalities, electrotherapy modalities if you need it, and appropriate exercises based on what I see in you. That's very important. Okay, nobody goes home without home exercises. Like if you want to get better without exercises, it's going to be very hard in certain conditions. Okay, so poor treatment planning is the next one. Reason number 5, overuse of medication. We already touched up a little bit on the previous point. Yes, we need to take some pain relieving medication when you have a lot of pain, but you need to know how to kind of wean it from there, right? You need to tamper it down as you get better. Don't get too much dependent on the pain medication. So what's going to happen? You take a pain medication, pain doesn't go down, you go and you get a next higher dose. And pain doesn't go down, you go and get next higher dose. How much are you going to go up? Then you're going to end up in opioids. So what happens? There's a lot of problems if you go into opioids, right? You know what's happening in Alberta with opioids addiction and everything. So you don't want to go to that stage, right? You get proper help, be involved in your care actively, okay? You can't just fix everything with pain medications and muscle relaxants, right? So that's why please do not overuse the medication. Consult your physiotherapist. Have an active approach towards your recovery, okay? That's all I want. And again, remember, pain is not equal to tissue injury. So these are the 5 things I want you to consider. I want you to think about it if you are in the acute pain stage, okay? And then get you out of this and then go consult a physiotherapist so that your acute back pain does not develop into a chronic back pain which you've been suffering for the last 2-3 years or next 2-3 years. Okay? Hope that makes sense. If you have any questions, give me a call at Instep Physiotherapy. I'm Giri Srinivasan, registered physiotherapist, and check out my show, Ask Giri the Physio Show, or our website, physioshow.ca. If you like it, please subscribe and share with your friends and family, and we are here for you for bumper to bumper treatment. If you have issues with your tissues, we got it. Bye.